Hi, I'm Dr. Lauren Mathis, and welcome to my website, wichitafallsthyroiddoc.com. I find a lot of people come to my website for a variety of reasons, but mostly because they're frustrated. Frustrated because either you or a loved one is suffering from a thyroid disorder and you're just not getting the answers you're looking for. Or you may be tired of the medical merry-go-round, as I call it. Here, try this medication. Oh, that didn't work? Well, here, try this medication. And basically, playing Russian roulette with medications trying to help you. Or you may have just been diagnosed with a thyroid condition and you're looking for a natural solution to your problem. Or you may have been taking thyroid medication for years and you just deep down inside know there's got to be something more. There's got to be something different you can be doing. Whatever brings you to my website, welcome. You've come to the right place. Now, a lot of people ask, why are you so intensely interested in thyroid problems? Well, my wife developed thyroid problems following the birth of our last child. And quite frankly, the answers we got from the medical community were subpar at best. Basically, it was just, here's thyroid medications, and when that didn't work, it was you need antidepressants, and that's all we have to offer you. So that launched me on an intense search and research into what causes thyroid problems, studying a lot of biochemistry over the last 3 or 4 years, so I could help my wife get over her thyroid problem, get the feeling back to normal again. And a lot of what I discovered there is what I want to share with you on this brief video. Now, on this brief video, we're going to just do a quick overview of thyroid problems, some of the symptoms you can have, and how my approach to treating thyroid is completely different from probably most practitioners that you've seen. However, I would like to recommend that you click on the Contact Us button at the top of the page, or scroll down to the bottom of this page, and down below you'll find a box where you can enter your name, your email address, your mailing address, and your phone number, and I'll gladly send you my 45-minute DVD where I go into much more detail about what we're going to discuss today. Please be assured that your privacy is important to me. Your information will never be sold, rented, or traded. We keep it completely private. So, let's talk about thyroid problems. What are the different symptoms that you can have that would make you think that you have a thyroid problem? Well, let's look at some of them. The first condition is hypothyroid, or where your thyroid is not working at its optimal level. Some of the symptoms that you can have is that you feel tired, you feel sluggish. You might find that you have cold hands, cold feet. You need to wear a sweater or a jacket when other people say, it's pretty comfortable. I don't know why you need a coat. You can find that you need excessive amounts of sleep in order to even be able to have a basic level of functioning. You might find that it's very difficult for you to lose weight, and you gain weight extremely easily, even when you're exercising and on a low-caloric diet. You may find that you have difficult and very infrequent bowel movements. You might find that you have depression and a lack of motivation. A lot of patients that come to see me for thyroid problems say, Dr. Mathis, I feel like I could sit in this chair and stay here all day and do nothing, and that's not like me. You may find that you have headaches that are raging in the morning but get better as the day goes on. You may find that the outer 1/3 of your eyebrow is disappearing. You may find that your hair is thinning on your scalp or on your body. You may find that you have excessively dry skin and excessively dry scalp, and that you're mentally sluggish. You don't process things as well as you used to. All those symptoms will make you think that you have some kind of a hypothyroid condition. The flip side of the coin is that you may have hyperthyroidism going on, or where your thyroid gland is functioning too much. It's doing too much work. And here's the symptoms of that. You may find that you're nervous, anxious, or very emotional. You find that your heart races or pounds in your chest and your pulse rate is through the roof. You might find that you have an inward trembling going on or shaking. You might find that you have insomnia. You have very difficulty falling asleep and staying asleep. You may find that you have night sweats, very similar to menopause symptoms, and you have difficulty gaining weight. Now, the third group is what we call Hashimoto's, and Hashimoto's is an autoimmune thyroid condition. Now, what do I mean by autoimmune? Autoimmune condition is when your body's own immune system is attacking its own tissues, in this case, the thyroid gland. And when you have Hashimoto's, you may have symptoms of hypothyroidism and hyperthyroidism. And it switches. It depends on what time of the year that you're having those symptoms. You may find that for a while you're hypo and then you're hyper. And very frustrating for you because it's hard to figure out what's going on. When you have an autoimmune condition going on with your thyroid, or basically, in my opinion, any thyroid problem, you should avoid iodine at all costs. Seems to be when you go to any kind of practitioner that wants to do a more natural approach, the first thing they want to do is put you on iodine. Iodine, friends, is like dumping gasoline on a fire. I do not recommend it. One thing I do recommend, though, is that you get this book right here called Why Do I Still Have Thyroid Symptoms, Even When My Lab Tests Are Normal, by Karazian. Datis is a good friend of mine. He is one of the smartest people I know, and he has researched literally thousands of research studies related to thyroid problems on how to get to the root cause of the problem and how to fix it naturally and get you back on the road to good health. Because, friends, that's what it's all about, right? So, the question you probably have is, how are you different, Dr. Mathis, than every other healthcare practitioner I've seen? Well, give me an opportunity to explain it to you. The first thing I would say is that I treat you and not your label. One of the most important things that the doctor who treats you needs to understand is that when you have a thyroid condition, there's other processes and tissues in the body that are not working properly. And we need to look at you globally as a whole patient to see what's going on. How do we do that? Number one, by doing complete metabolic testing. Now, what do I mean by that? We run lab work on you. Now, I know the first thing you're going to say is, well, Dr. Mathis, I've had lab work done, and my lab tests are normal. I hear that so often, it's crazy. Let me just say this. Most lab work that most patients have done that come to see me is basic blood work at best. Usually most doctors run one thyroid test, it's TSH, and that is wholly inadequate to diagnose and discover what the root cause of your problem is. We do a complete metabolic profile when you come in. It includes a complete thyroid panel, lipid panel, adrenal panel, food and allergen sensitivity testing, bacterial, fungal, viral, and parasitic testing, hormone panels, the complete metabolic panel. Once we have all of that information, we can pinpoint, number one, what's causing your problem, and then we can move on to developing a personalized and customized treatment plan for you. We also do a complete neurological evaluation. Why? Because your brain and your nervous system control everything. If there's a problem there, that's often what leads to tissues and organs in your body not working properly. And like I already alluded to, once we have that information, that's how I build a personalized and customized treatment plan just for you, so that we can get you feeling better, functioning better, and back on the road to good health. As I mentioned before, if you'd like more information on what we just discussed, where I go into more detail, I'd be glad to send you my free 45-minute thyroid disorder DVD. To get that DVD, simply click the button above me that says Contact Us, or scroll to the bottom of the page, fill out the information. We keep your information completely private, and we'll mail you out the DVD right away. This is Dr. Lauren Mathis. I want to thank you for listening, and I'm looking forward to hearing from you.